What if the way you sleep tonight could quietly increase your risk of a stroke by morning? This may sound alarming, but it is not speculation. Emerging research shows that nearly 1 in 3 strokes happen during sleep or within the first hours after waking. These events are often not triggered by emotional stress, high cholesterol, or missed medication. Instead, many are linked to something most people rarely consider: how they sleep. Recently, I reviewed a case involving a 68-year-old man who was active, ate well, and had normal cholesterol levels, yet he suffered a stroke shortly after waking. There were no clear warning signs. Further evaluation showed the cause was not genetics or diet, but his sleep position combined with a few bedtime habits. Welcome to the channel. I'm Dr. Sarah Williams, and here in the UK my focus is helping adults understand how everyday habits affect long-term brain and heart health. Today, we'll explore the science behind sleep and stroke risk, joined by expert insight into how circulation becomes more vulnerable with age. Many people believe strokes happen suddenly and without warning, but the truth is that risk increases when blood vessels become more fragile, something that often begins after age 50. At night, blood thickens slightly, blood pressure can fluctuate with movement, and even small positional changes can affect circulation. While we can't control when we fall asleep, we can control how we sleep, and that choice matters more than most people realize. In this episode, we'll cover 5 sleep habits that quietly increase stroke risk overnight, especially in adults over 60. We'll also discuss the 2 safest sleep positions for protecting your brain and heart, along with simple ways to make your bedroom more supportive of healthy circulation. Many strokes don't occur during daytime stress, but during sleep, when the body should be repairing itself. Certain nighttime habits can place silent pressure on the brain and heart without obvious symptoms. Small decisions made before bed or during sleep can disrupt blood flow, raise intracranial pressure, and even destabilize plaque in the arteries. One common habit is sleeping flat on the back without a pillow. Many people believe this is good for posture, but for older adults, particularly those with high blood pressure or mild sleep apnea, it can be harmful. When the head is level with or below the heart, gravity allows blood to pool toward the upper body. While younger vessels may tolerate this, aging blood vessels are more fragile. This position can increase pressure inside the skull, reduce oxygen delivery, and strain tiny vessels in the brain and eyes. Some people wake with headaches, dizziness, or blurred vision and never associate these symptoms with sleep posture. These can be early signs of circulation problems or minor vascular events. The solution is gentle elevation. A medium-height memory foam pillow that raises the head about 15 to 30 degrees above the heart can improve venous return without straining the neck. For those with reflux or snoring, slight upper body elevation can also reduce breathing difficulties and nighttime blood pressure spikes. Another overlooked habit is sleeping on the right side, particularly in individuals with heart conditions. Most people never consider which side they sleep on, yet anatomy matters. When lying on the right side, body weight can compress the inferior vena cava, the large vein responsible for returning blood to the heart. This vein runs along the right side of the spine, and pressure on it can slow blood return, forcing the heart to work harder. Additionally, the heart naturally sits slightly left of center. Right-side sleeping can press it toward the chest wall, subtly limiting its movement. While healthy individuals may tolerate this, those with high blood pressure, heart failure, or nighttime chest discomfort may experience worsening symptoms. Some cardiologists believe habitual right-side sleeping in people with cardiac issues may increase arrhythmias or reduce oxygen levels during sleep. A simple adjustment is switching to the left side. Left side sleeping reduces pressure on major veins and allows the heart to pump more freely. If staying on the left side is difficult, using a body pillow can help prevent rolling during the night while keeping the spine aligned. This small change can be one of the easiest yet most effective ways to support heart health during sleep. Using multiple pillows or an overly high pillow is another common issue. Many people stack pillows to help with breathing or reflux, but excessive elevation can push the head forward, bending the neck unnaturally. This compresses blood vessels that travel through the neck, especially the vertebral arteries, which supply the brainstem and inner ear. Partial compression during sleep may not be noticed immediately, but over time it can contribute to poor circulation, neck stiffness, tension headaches, and morning dizziness. Some patients attribute these symptoms to stress or aging, yet adjusting pillow height often resolves them quickly. Chronic overelevation can also affect microcirculation in the brain, potentially increasing vulnerability to silent strokes or transient ischemic attacks. The goal is neutral alignment. One well-designed pillow, preferably low to medium height with cervical support, is usually sufficient. If elevation is medically necessary, such as for reflux or breathing disorders, the entire upper body should be elevated evenly using a wedge or adjustable bed, not just the head. This keeps the neck neutral and allows blood to flow smoothly to the brain. Sometimes, small changes like switching pillows can have a meaningful impact on long-term brain and heart health. The fetal position is another widely used sleep posture, especially among older adults. While it feels comforting, curling tightly with knees drawn up and chin tucked can create circulatory and respiratory challenges. This position compresses the chest, limits lung expansion, and promotes shallow breathing. Reduced oxygen intake overnight can lower blood oxygen levels, which becomes riskier with age and in those with heart or lung conditions. Tight curling also increases tension in the neck and shoulders, potentially compressing small blood vessels near the cervical spine. Some people wake with dull headaches or neck pain without realizing their sleep posture is responsible. Rather than eliminating side sleeping, the goal is moderation. Slightly straightening the legs, relaxing the upper body, and maintaining a neutral spine can improve airflow and circulation. Using a body pillow between the knees and arms helps maintain alignment without forcing the body into a tight curl. Sleeping smart doesn't mean sleeping rigidly. It means allowing the body to rest in a position that supports breathing, circulation, and overall recovery. Going to bed immediately after eating or drinking alcohol is another habit that often goes unnoticed, but carries significant risk. After a large evening meal, blood is redirected to the digestive system, reducing availability to the brain during sleep. While younger bodies adapt, older adults with narrowed arteries or cardiovascular risk may experience dizziness or circulation instability overnight. Alcohol further complicates this by dilating blood vessels, which can cause sudden drops in blood pressure followed by compensatory spikes. These fluctuations strain vessel walls and can contribute to clot formation or vessel rupture. Waking with a pounding heart, headache, or mental fog may reflect nighttime circulatory stress rather than poor sleep alone. Ideally, dinner should be finished at least 3 hours before bedtime and alcohol avoided for at least 5 hours before sleep. A gentle walk after dinner can help regulate blood flow, glucose levels, and digestion, supporting safer, deeper rest. These habits reduce strain on the cardiovascular system and lower stroke risk during the night. Now let's focus on the 2 safest sleep positions. First is left side sleeping, which offers several benefits. Because the heart sits slightly to the left, this position reduces resistance the heart works against and improves circulation to the brain. Gravity also places the inferior vena cava in a less compressed position, improving blood return. Research into the brain's glymphatic system shows that side sleeping, especially on the left, enhances the brain's ability to clear waste products such as amyloid beta. This process supports long-term cognitive health. Left side sleeping also reduces nighttime acid reflux by keeping stomach acid below the esophagus. For those with GERD, chronic cough, or chest burning after meals, this position can significantly improve comfort while protecting the cardiovascular system. The second best option is sleeping on the back with slight elevation, raising the upper body about 15 to 30 degrees. This improves venous return, reduces intracranial pressure, supports breathing, and lowers the risk of oxygen drops overnight. Adding slight knee elevation further supports spinal alignment and circulation. No single sleep position works for everyone. People with sleep apnea may benefit more from side sleeping, while those with joint pain may prefer back sleeping with elevation. The key is choosing what best supports your body. Sleep quality matters as much as position. Aim for 7 to 8 hours of uninterrupted sleep to allow blood vessels to repair and the nervous system to stabilize. A stroke-protective bedroom also plays a role. Keep the room cool, ideally 18 to 20 degrees Celsius, to support deep sleep and lower nighttime blood pressure. Avoid blue light after 9 p.m., as it suppresses melatonin and delays restorative sleep stages. Use a pillow that supports natural neck curvature and minimize sudden noises that can trigger stress responses during sleep. Tracking nighttime health can also be helpful. Devices that monitor oxygen levels or heart rate variability may reveal early signs of circulatory stress. Finally, remember that sleep posture is not just about comfort. Sleeping poorly can quietly increase stroke risk by affecting blood flow, oxygen delivery, and brain waste clearance. You don't need medication to improve this, just awareness. Change one habit tonight, and the benefits may extend for years. Your brain, heart, and vascular system depend on it.